Hi, I'm Rhonda Weisgill. Welcome to the Promise Project. I'm the Director of Performance Improvement and Innovation here at GBMC. I'm excited to share with you today our mock-up of the physical space. Traditionally, when design is embarked upon, it's a number of stakeholders sitting around a table with the architects. They come up with what they want and they go on to build that. Here at GBMC, we like to ensure that we are including the key stakeholders in that design process. And in past construction, we've used something called a 3P design, and that's preparation, production, and process. It seeks to drive out waste and optimize the value of the space. We also recently have incorporated something called human-centered design. That's something that in my 25 years of healthcare I've been trained in. Human-centered design focuses on learning from the end users, redefining the problem, brainstorming solutions, prototyping, and testing. It really seeks to inspire innovation and understand the art of the possible. Combining those two processes has really allowed us to ensure that we start and end with our customer needs. Recently, we were able to pull together a number of stakeholders that include clinicians, frontline staff, ancillary, spiritual services, our Patient Family Advisory Council, as well as a number of other key stakeholders. Through a facilitated exercise led by our architects, we were able to do a tabletop conceptual design, where they were then able to physically mock up a tabletop design of what a space might look like. And now we're in the space that's been constructed based on that design. So come on, let's take a look. This is a patient room. Based on the tabletop design that we facilitated, the stakeholders came up with this. We were able to construct this and physically bring tours of those stakeholders back through and have them interact with the space. And that was really important because a key part of the human-centered design process is that we gain momentum through prototyping and testing our solutions. As clinicians and ancillary staff and others interacted with the space, they quickly realized the need to redesign. Those minor changes add up to a lot of changes that might require us to move physical space. For example, this foot wall was too close to the bed when there were family members gathered around. The bathroom that we envisioned as so large might be a bit small for those patients who require additional assistive devices. And now more than ever, in our COVID-19 pandemic response, we're learning a lot about the space that we need to interact with. And that's going to require some large changes to how we're thinking. The idea of that art of the possible that we don't even know yet, and we don't have necessarily the evidence for. So those changes need to be incorporated. Changes like enabling telehealth in a patient's room so that visits can happen from their families from afar, so that other specialists can call in. Ensuring that we have digital whiteboards and patient boards to be able to communicate with our patients. We also recognize that physically the space might require that we access the outside of the room from the inside of the room. So we've enabled closet space that opens from both sides to be able to receive a meal tray or linens perhaps, rather than having someone bring them into the room. These are all considerations that we didn't necessarily think about in the beginning. This response that we're in right now has forced us to think that way. And that's really been the beauty of the 3P process combined with human-centered design. We're driving out waste, we're inspiring innovation, and that enables us to think about what's viable, feasible, and most of all, desirable for this organization. One key insight, as an example, that we were able to gain from the stakeholders during the mock-up exercise was that they wanted to be able to visualize their patient and family member from outside the room. This is an example of an alcove where you can easily visualize two patients right here while also collaborating with the team or a family member. Here we are in the team station. You might know team stations historically known as nurses' stations, where it was a small cramped space that nurses would go to document and interact with the doctors on the unit. From our key stakeholders in our design process, we understood that this should be a team station, where we're enabling collaboration and communication among all the specialties. We have a large mid-counter space that's enabled where we can put mobile devices as specialists come into the unit. We also have considered the need in our times now to potentially keep staff at safe distance, and we've enabled that in this large space. Directly across from the team station will be our med room. Our med room has fully functional medication delivery devices, including a large refrigerator space, which was another key insight from our stakeholders. One of the design considerations that we learned through testing this space after the prototype was that the original tabletop design and the construction put the pneumatic tube where we have medications delivered across from the med station. The staff quickly realized that for efficiency, they should have the pneumatic tube here. So that's one example of the design changes that we'll make. This process has really been masterful in ensuring that we've listened to all of our stakeholders, including our patients and families, walked them through the space, and understood what we as a hospital can best do to serve the needs of our community and to deliver on our vision phrase. To every patient, every time, we will provide the care that we want for our own loved ones.